Hello friends, I'm Dr. Tamim. We have with us Dr. Sricharan, who's got second rank in the NEET exam this year, 2019. So it's a matter of great honor and privilege for all of us, for our state, Karnataka, for our college, Bangalore Medical College, for our institute, DBMCI. It's a matter of pride over here, and all of us are extremely joyous and very happy. So Sricharan, please introduce yourself. Where are you from? Which college? And
I am Sricharan from Bangalore. I studied in Bangalore Medical College. I joined DBMCI in March 2018 after completing my internship.
okay. So how does it feel? I mean, to get rank two.
Honestly, I still cannot believe that I can have got this ranks.
It takes some time, I think, the settling down and that feeling, it will
Yes.
take some time. Okay. So, how were you like in your UG? Were you always a topper or were you kind of, how would you rate yourself? Average, above average, excellent?
I was just an average student
Average
in UG.
student. Okay, so that means there is always many students come and tell me, ki, sir, I'm an average student in my UG. Do I have a chance of doing well in the entrances? So I think anything you'd like to say?
There is nothing like how we were in UGA will be the same thing.
Okay, if you work hard, you can improve at any time.
Yes.
Great. How was your NEET rank last year? You gave NEET last year. You
Yes,
completed
2000.
internship this year,
Yes.
and after internship, you joined us.
Yes.
Okay, so last year, how was your NEET rank?
I got 7,500.
7,000. How were you? Like, were you studying in the internship?
No, sir.
No.
Honestly, I didn't find much time to study, so I was just cool in the internship with learning the
Focusing on
skills
the
and
clinical skills. I think that's one of the things we see in BMC where they just focus on learning clinical skills in
yes,
internship and start preparation after
start
that.
preparing seriously after
Okay.
that.
So, apart from DBMCI, did you do coaching in any other place? No, only
Only
Bhatia
DBMC.
Institute. Okay. So when you joined us and you started preparation, how was your mode of preparation? Like, what was your typical week?
Initially, during the first few classes, I used to study. There used to be around 3 to 4 days gap between the classes,
Okay.
and I used to study the notes thoroughly first.
So you attended
class
all the
notes.
classes?
Yes,
You attended all
all
the
the
classes.
classes.
Okay.
So I used to finish studying my notes thoroughly first, and then I used to just go through the guidebooks. If there were any additional points, I used to write it down in the notes, and I used to solve the relevant MCQs in the books regarding the notes.
Okay. So from the subject-wise books, you used to do the questions, add the important points into
Yes,
the class
in the
notes.
class notes.
So class notes, you used to make it comprehensive.
Yes, sir.
So for most of the subjects in our classes, like, was there a lot of stuff that you needed to add, or do you think they
No,
were
sir,
sufficient?
just they were
The class notes
absolutely
were sufficient.
sufficient.
Okay. So, so this was how your typical week used to be. You would attend the class. I mean, on the day of the class, were you doing any reading?
No,
No.
sir.
Were you discussing with anybody?
We used to have a WhatsApp group.
And you used to discuss in
in
that.
the group
Like an oral discussion during class,
during
in
class
break
and during
time.
breaks and
Anything you didn't understand, you would discuss.
yes.
Okay. So once the class would get over, you would go home, read the notes. And how long would it take for you to read the notes? Like for say subject like patho, for example.
Take around 2 to 3
2 days just to read the notes and then do the questions
Since
and add additional points to the
points in
class
the
notes.
notes.
Okay. So you were basically able to finish each week one subject,
Yes.
making your notes comprehensive, right?
The notes should have everything.
Everything in
whatever
it. So the class notes are the only thing that you
only
needed for
stop.
revision.
Yes.
Okay. So when did you start your revision?
I started it after Vibe session in
Vibe
September
session.
2000.
How was your impression about the vibe?
Vibe was really helpful. It covered so many image-based questions which had appeared in this NEET 2019, and a few updates also.
So
which
you
could not-
saw the actual images did come in the exam.
Yes.
What was discussed in the classes? Great. So how would you rate the difficulty level of the images that were discussed in the vibe? Was it too hi-fi or was it too basic, or how would you say?
It was just whatever
appropriate.
we needed. So it
Great.
was not too high-fi.
Okay. And as you were telling me just a few minutes back that whatever new updates had come, that also was covered in vibe. What could not
Yes.
have been covered in the classes, right? So immediately after vibe, you said you had started your revision.
Revision.
Okay. So how did you plan your revision? Like,
Initially, I started with the first year subjects, and then I went to the second year, and lastly, clinical subjects, which will take many days for revision.
Okay, but you started with the first year
First year
subjects.
subjects.
We had, I think, structured some tests every 3 days or 4 days.
Yes, sir,
You
every.
just followed those tests?
Yes, sir. I
You
just followed
followed.
the
So
test.
each thing you were just trying to prepare for that test.
Yes.
Okay. So I think that's a good idea. No, what we did this year, that is once the class got over, we structured tests every 3 days or 4 days, and you just had to prepare for
Prepare
that
for
test,
the
and that would
test.
cover one more revision.
Yes.
Great. So you were able to finish how much of it, like before the AIMS exam?
I was able to complete exactly one revision.
One revision before the AIMS exam. And how was your performance in November AIMS?
I got 310 ranks.
310, not bad. And then I think after that, between PGI, you did some more revision.
Yes, some important
Important topics you were
points.
able to do. And how much you got in PGI?
54.
54. I think that's good. That must have given you a lot of confidence to move
Yes.
forward. Okay. So after PGI, between that and All India, how many revisions were you able to do?
I was able to do around 2 revisions.
2 revisions. So basically, what is really required is 1 revision before AIMS and 2 revisions
Yes.
after All India. Okay. In your preparation, like, were you doing questions every day during revision
Yes.
at least?
Yes, I used to take around 1 to 2 hours just for MCQs every day.
Every day, 2 hours of
So
questions. So I
whatever
think
we
that's
did.
what we also say, like around 20% of your time should go for questions. So if you're studying about 10 hours, about 8 hours for theory and 2 hours for questions. Where were you studying, in the library or at home?
At home.
At home. Okay. And anything else you were doing in your revision? Like, how were you using any techniques to memorize, or what was your method? Were you just sticking to books?
I was just sticking to the books and some topics like micro and all. It's mostly memory based, so I had to do some mnemonics for that.
Okay, you made your own mnemonics and you were
and
memorizing
most of
them
the mnemonics were also given in the class
in the
itself.
class, and you thought they were good enough.
They were good enough.
Okay. So basically, what you did was you kept your class notes and you kept on doing revision on that. So you felt the class notes were sufficient?
Yes, sir, it was more than sufficient. Just some few points we have to add.
Okay. Any faculties that come to your mind who in DBMCI made a big difference to your preparation?
I liked Ashwani sir's class,
Okay,
class,
anatomy.
and then physiology class by Dr. Ashish sir,
Okay,
and then patho class by Dr. Praveen sir,
okay.
and surgery class by Dr. Jay Arora sir,
Janandar. Okay.
and medicine class by, of course, you sir.
Yeah, okay. So, in medicine, because it's my subject, anything else that we need to add in the notes, or do you think that
No,
is
sir,
sufficient?
it was more than
It
enough.
covered everything, and all questions came from the class notes?
Yes.
Okay. So, next year, if I have to do anything else that you think I need to add, or do you
No,
think
sir, it
it's
was
sufficient?
sufficient.
Okay. Okay. So, how did you find our test series?
Tests were really helpful. Like initially, I used to not get such a good rank in tests, but as all the subjects passed by and I used to do all the tests and I used to be sometime somewhere in the first list.
In the first list, so in the
First
first
list.
page. I think that's the
First.
target everybody has got over here in our classes. Already, I think in our classes the competition is so high that if people are topping here, they're already topping in the national level.
Yes. So most
So
of the time when you get the rank in the first list, it gives you so
in the
much
first page,
confidence
yeah,
that you
great,
can do it.
good. So were you doing all questions, or you doing only last 5 year questions?
Last 5 year questions
Was all
the
that you
main
focused
thing.
on? Did you do any NEET previous year papers?
Uh,
No.
no.
You just stuck to the overall subject-wise guides and last 5 year papers.
Yes.
So sometimes we see now people are deviating into some, online stuff and all that. Do you really think that makes a difference, or you stuck to the classes and the
Whatever
notes?
class tests and the online tests which used to be conducted by DBMCI, grant tests, they were the most important motivating
Important ones.
factor.
Okay.
And
And you were doing well in that? You were getting within 10? I mean, how is it?
in grant tests, not much, but in class
Okay.
tests, I used to get.
You used to get within the first 10. Okay. So I think that's amazing. Any other advice you'd like to give?
Um, It's not that you cannot do it. Everybody has that strength in them. They have to work hard. It's just the perseverance and the hard work that really matters. Initially, in the starting days, you will feel like there's so much less time and you have to cover 19 subjects. But as the days go by and you start doing well in your tests
Tests.
and grand tests, and as you read the subjects and grasp the knowledge, you will feel so much confidence. And during the initial last stages, after you give your aims, PGI, it gives you much more confidence that you can really do it in the NEET exam.
So I think all those who will be watching this, their main thing is what can we learn from this? I mean, how is it? What do we really need to do to be a topper? So what do you think is special that is required to get? I mean, getting this kind of rank among more than a lakh competitors, for you, I think it's still sinking in. But for all of us, I mean, it's something amazing. So what extra that do you think a topper needs to do actually
Uh,
to get into the top zone? What exactly is required?
There is no special secret to success or anything like that. Topper, being a topper, also we do the same thing which every student does. So it is just that hard work and the fire in you that you have the motivation that you have to do well and you have to become a good doctor and you have to top in the exam that matters the most. And everyone can do it.
True. So the technique that we've been following in our institute is basically most of it is conceptual, and this is a little different from what we're seeing in the other places. So how do you think? I mean, do you think that's the right thing, or
I think the classes were unique in that they stress more on the concepts. They made us understand the concepts and what we need to learn and how to attempt the questions and how to exclude the options and all those
so
things.
some of the techniques that we discussed in the classes,
Yes,
they
so
are
they are
really
really
useful.
helpful in the.
Okay. So what subject you plan to take now?
I plan to take a medicine.
Medicine. Okay. So all person needs to do. Those of you who are not that happy with your results now, I think he's a classical example. People have he got around 7,000 plus rank last year, and with persistent effort in a year, everything can change. It's just a matter of belief and persistence. So I think it's a logical approach. It's conceptual approach. Just focus on your concepts. Um, just focus on the class notes, add additional points that are there in the class notes. That's what he's done. I mean, just the class notes, and keep revising the class notes. So I think anything else you'd like to add? Anything else you used in your preparation?
Um, I think
So mainly this
is
is the straightforward technique.
revision is the most
Revision is the
important
most important
important
thing.
thing.
Okay,
And
during your revision phase, how many hours were you studying?
uh, during revision phase, around 12 to
12
13
hours. But
hours.
initially during classes,
During classes, around 6,
6
5,
to
5 to
7
6
hours.
hours.
It'll get fatigued, I think, not totally.
Yes, sir.
Okay. So when you used to the grand test and the class test and all, were you going through all the explanations, or you doing only those which you got wrong?
Um, Initially, since it was just the beginning, I used to go through all the explanations. But
In
as
the
the time
later
passed by,
stages, you
just
just the
the
mistakes.
mistakes, whatever.
Okay. Okay.
The explanations were really good in the grand
Okay.
tests.
So about what phase you started getting in the first page in the class test? Like right from the start, or
No, it took around after 2 3 months.
2 3 months? I think that's what it is. I think 2 3 months of persistent effort, and you start coming in the top zone already. Like your how was your May aims?
Memes, it was okay. So I got 400.
400 something. So I think consistently you have improved from 7,000, you got to 400, then you got 310 in November aims, then 54 in PGI, and then second rank now. So it's an awesome performance, Sricharan. I think all of us are so proud of this achievement of
Thank you,
yours,
sir.
and we hope you continue to achieve success in your future also. And any advice, final advice, what 5 subjects you would say are most important that the students should be, spending more time on?
I would say it is medicine, surgery, uh, anat, physio, and patho.
Patho. You would say these five
These five
subjects
subjects are the
people
more
should focus
important.
on, and they are going to be the rank scorers. Okay. So when you went for the NEET exam, last 10 days, what was your plan? What were you doing in those last 10 days?
I had finished revision around a week before the NEET exam,
Mm-hmm.
and last 5 days I was just solving a few difficult MCQs and just going through important topics,
Okay.
which were like very recent updates or anything like that.
Okay. Okay. So all the volatile stuff and all the things you had planned up. So I think this is all there is to it. Just a straightforward path. Attend the classes mindfully, write down the notes properly, add additional points to your class notes, make your class notes your comprehensive book, and then keep revising it. So nothing much, nothing much that else that a person needs to do. But I think one of the problems is ki sometimes people just write down without understanding, and they don't focus much in the class. Sometimes you see in the class ki people are looking here and there, but I think
So
always you used to be in the first two rows in the class.
yes,
Whenever I noticed.
I think listening in the class and understanding is one of the most important thing. I think half the job is done there itself
True.
if you do it there itself.
Okay.
And
And I think in your group of discussion, all the others also have done very well. I
yes,
think
they
Krishna
also
got
got
into
11th rank.
radiology aims.
Yes,
Okay. And then your other friends also have done very well.
yes,
So I think that's good. I think having a group of people who are discussing, and that discussion level also makes a difference.
yes. That is just your dream that to secure this rank that will motivate you to achieve your dream. And I wish you all the very best.
Thank you so much.
Thank you,
Thank
sir.
you.
Thank you.